My name is Ian Maness, and I'm a family nurse practitioner. In 1998, a great little movie came out called Patch Adams. You're never supposed to tell anybody this story, but it did, and I was a second-year sophomore college student who had no idea what he wanted to be or where he was going with his life, and so the movie was very inspiring. And so immediately I went to my girlfriend, now wife, and said, hey, what do you think about me being in healthcare and being a nurse or a doctor or what have you? And she said 100%. She said, you love to take care of people. You should do that. So I immediately switched my major to biochemistry and then eventually fell into nursing school and have been doing this for 20 plus years now. I chose family medicine, and I would actually say I think family medicine chose me. I was a nurse, ICU, ER nurse for 10 plus years at the University of Texas Medical Branch in Galveston, Texas, go UTMB. And I went over to inquire to the nursing school about the NP program. I ended up meeting up with a colleague that I hadn't seen in 10 plus years. He said, what are you doing over here? I said, oh, I came over to get a brochure. I've been thinking about it as far as maybe in the future. And I said, what are you doing here? And he says, I run the NP program. And I said, oh, and he said, when do you want to start? And so I was very fortunate to have fallen into an immediate acceptance into the NP program just based on being a nurse for many years. And then through that clinical experience, in primary care, I knew that I had found a home for taking care of patients in that setting. So I've been doing it for now 10 plus years. I decided to work with Samaritan at first temporarily. I came through as an ICU travel nurse. And then after immersing myself in the community, we decided to stay here and came on full-time with Samaritan. My approach to patient care is informed decision-making. I think healthcare has changed a lot over the last 20 years that I've been in healthcare. And I would say that what I bring to the table is 20 years of experience navigating the healthcare system. And so we together, me and the patient, work to find their diagnosis and the treatment plan that works for them. When I'm not at work, since my wife and I are new empty nesters, we spend a lot of time walking the beach with our dog, trying to navigate this next phase of life. And I'm also very lucky to say that I live just down the street from an incredible surf break, so I spend a lot of time surfing.